Okay, I think we are back live on Facebook. Sorry about the little glitch. We were in the middle of introducing ourselves, and I think Amanda got cut off in the middle of her introduction. So why don't we try that one more time?
Okay, hi everybody. Thanks for tuning in. As Malia said, I'm Amanda. I am an associate professor of epidemiology at the University of Wisconsin-Milwaukee, and my research focuses on psychosocial determinants of infectious disease, thinking about links between infection and chronic disease, and more broadly, thinking about the life course mechanisms by which social inequities in health occur.
I'll go next. I'm Jenn Dowd, an American living over here in the UK. And I'm an associate professor of demography and population health at Oxford. But my background's also in social epidemiology. I've worked a lot with Amanda on looking at the social determinants of infection and immune function, and also links between infections and later disease. And I'm also, kind of interested in, thinking about how demography affects the spread of the virus. So things like population age structure and sex differences in how the epidemic is playing out.
And hi, I'm Alison Buttenheim. I'm a public health researcher, and I'm on faculty at the University of Pennsylvania School of Nursing. I study behavioral aspects of infectious disease prevention, which before COVID was things like vaccine acceptance and HIV and Chagas disease in Peru. And now is a lot of COVID, and also trained like Malia and Jenn in demography. In fact, I've been reading one of Jenn's recent papers today, which is a really gorgeous paper. I hope we get to talk about it a little bit today.
Great, thank you, all three of you. I'm hearing that our video was cutting out, but it's good now. So I think everything's working. Right. My name is Malia Jones. I'm like Amanda, I'm a social/infectious hybrid epidemiologist, and I work at the UW Madison's Applied Population Lab. So I want to dive right in today. For those of you who are joining us, please put your questions in the comment box, and I will do my best to try and keep track of those questions and answer as many of them as we can get to. But we had a few advanced questions come in, and some of these actually come from last weekend. We were scheduled to do a Facebook Live last Sunday, but we canceled it because of the Black Lives Matter protests and the unrest that was happening in many of our cities across the world. And I just want to start off, we have a number of practical questions about this topic, but I do want to start off by saying that I think a lot of us who study the pandemic and also social root causes of health disparities, such as systemic racism, are really torn right now because I think we are going to see cases cropping up as a result of the mass protests, and at the same time that we support the protesters and the reasons for those protests and the need for systemic change. And so, as we address these topics of risk harm reduction at the protests, I just want to keep in mind that we do have this tension where we're seeing where, we have both. We support the protesters and we're concerned about disease transmission at the protests. So Amanda, I know you want to talk about this topic in particular, so I'll throw this one to you. I have a number of questions about how to do harm reduction at the protest and what to do after having been to the protest. So you want to tackle a few of those questions?
Sure, thanks. And I'll just build off of what Malia said, in that we recognize this false dichotomy really in asking people to either stay home, not protest and protect themselves from COVID, or go out and protest, because the reality is for many communities that are protesting, even if they stay home, because of those same upstream social structural factors and systemic racism, they will still be at greater risk for COVID. And so that it really is a false dichotomy, and we do support this broader effort to address some of these structural factors that inevitably are the determinants of a range of health outcomes. And so thank you to those, communities that are engaging in this really important work right now. And there are ways that we can engage in protesting and sort of reduce some of the risk involved. We have been posting this week on this topic, and Malia and I have, been giving interviews on this topic this week. And one thing off the bat that we want to emphasize is that there's a role for individuals in this setting. There's also a role for law enforcement. And so we're going to address both of those issues. For the individuals going out and protesting, some benefit to being outdoors, but we still want to try to maintain social distancing when you can. If you go out in groups of people that you already are in contact with in your household, and you can mainly stay with those groups, that's better than mixing into a crowd. We know that that's not always possible. Wearing a face mask is definitely a must in these scenarios. While a lot of protesting involves shouting and call and response, and we recognize that, when there's opportunities to do other things like make noise with noisemakers, or amplify voices with megaphones instead of shouting, those are ways to reduce risk as well. And then there's other kind of just general guidelines that bring water, wear sunscreen, and bring food and snacks and other ways to sort of be prepared to be out on the street for a long time. And I think probably my colleagues here have some other tips that they can add on in terms of, from the law enforcement perspective. We think there needs to be a partnership with protesters to try to work towards infection control. And so that means not corralling people into tight spaces. That means not using respiratory irritants like tear gas and pepper spray, which actually, those types of things we think are adverse to health in a number of ways, not just in the context of COVID, but certainly making people cough and sort of exacerbating the droplet transmission is not ideal. And so we have a call and an expectation to law enforcement to partner with protesters towards infection control in these scenarios. And then if you've been protesting, you really could think about, in the next week, definitely monitoring your symptoms, number one, potentially seeking out a test. So it takes about an average of 5 days for symptoms to emerge, but it can take up to 2 weeks. We hope that communities will rally around protesters and provide free testing and support to individuals so that we can identify anybody who might have acquired COVID at these events. And then you might think about isolating yourself from anybody in your family who is vulnerable to adverse complications of COVID. So, if you're out protesting, maybe wait a week or 2 weeks to go visit your grandma or anyone else that you think is vulnerable. And I'll sort of turn it over to my other colleagues who I think probably have some additional ideas.
Yeah, any further thoughts on those?
Yeah, that was really helpful, Amanda. I had family members out in Philadelphia yesterday, and I really appreciate the reminder that we should get them tested in the coming week, especially as the summer with getting together with grandparents and other households. We need to kind of reset our clock in quarantining again before we think about that.
Can I ask, a couple of people have asked, when should you get tested? When is the test? So let's say you've had an exposure, possible exposure because you went to a protest yesterday. When will a test be accurate?
Yeah, I think here in Wisconsin, they're saying if you need a test, get a test. If you think you've been exposed, get a test. But I do think that you have to be aware that early on you could get a false negative, right? And so I actually don't, does anyone know the sort of sweet spot window for testing?
My understanding is about 3 to 5 days probably after initial exposure, you'd have enough replicating virus to detect. So,
and it could be before you have symptoms.
Yeah, absolutely.
That's consistent with my understanding too. And so what you get is, after you've been exposed, the virus starts replicating in your respiratory system. But there's not enough of it to actually pick up the virus to test positive on that swab that they stick up your nose until it's had a chance to replicate for a few days. And so it's not really a false negative. It's just that there's not enough virus yet to detect. So you want to wait. And my understanding is also 3 to 5 days should be good for in most instances, but also monitor symptoms because that's not a perfect metric.
Yeah, but keep in mind that you may be someone who doesn't have symptoms, asymptomatic person, or you could be in that pre-symptomatic phase and still test positive. And it's really in that window of time where people are transmitting to others. And so being proactive about, seeking out a test is a good idea, I think.
Yeah, and in the meantime, masking around, especially vulnerable family members, and keeping a safe distance, all of that is a good idea.
So we've had a few more kind of biology of the virus questions that are related to that conversation. One of them is, do any of you know about when do you become infectious, and how is that related to when you show symptoms, if you are going to become a symptomatic illness of COVID-19? We know that people can be transmitting virus before they show symptoms, but have any of you heard when, the timing of that? I have not, to be honest.
Yeah, my understanding where they've tracked, I guess, some studies in Asia where they were able to track the full course of the virus shedding from people who were exposed, that it actually looks like the peak kind of shedding is prior to the onset of symptoms or at the very beginning of symptoms.
Mild
after you've
symptoms.
had it for even 10 days or so, actually your infectiousness starts to decline even while you're still very sick. So that's a blessing and a curse. It really is these early days when you would least suspect it that you're going to be most contagious.
I think Lindsay Leininger, our fellow nerdy girl, posted on the incubation period and the infectious period a while back. So that post is up on Facebook too.
Okay, I'll see if I can track that down and post it in the comments.
I think it actually peaks at the very first days of symptoms for symptomatic people.
And that's really important to why this infection is so transmissible, right? Because compared to something like influenza, where I think the period in which you're transmitting is when you do have symptoms primarily, in those sort of like 2 to 4 day range post symptoms when you're likely to be staying home anyway. That is a difference between these infections and why it's challenging to identify people and to isolate people with this infection.
Yeah, that's why that and the asymptomatic infection that are still contagious are the reasons that it's so hard to do outbreak control just by telling people to stay home if you're sick, right? That's the typical advice for influenza, and that advice actually works pretty well, but that's because influenza is very rarely asymptomatic, and you're infectious when you're feeling sick. So So another question related to this sort of issue of timing and the protests, unpopular opinion, I think we are going to see a lot of illnesses acquired at these protests. And I have also noticed flying around on social media, the United States is seeing a little bit of a spike in cases right now. And I just want to talk a little bit about the timing of when we see when we might expect to see those infections emerge in the data, and why are we already seeing this spike? Alison, is that what you want to tackle?
Yeah, I think one of the things we all need to keep in mind is that these windows of incubation period and infectiousness and time to symptoms, there are ranges on all of them. And when we see when community spread is driven initially by intra-household spread, we're also going to see a couple of cycles of incubation period before an event might lead to to a community spike. And the third thing to keep in mind, and I think we're learning a lot fast and we don't necessarily know yet, is how important these sort of super spreader events and super spreader people are to creating hotspots or creating sort of new spikes. So if we just go by kind of our, the epi math and the infectious disease math that we know, we would say a big event, if there are going to be people there who are infected, other people are going to get infected, it's going to take, 1 week for one cycle and maybe 2 weeks for a second cycle. And so we should see the spike at 2 weeks. And when we don't, then we wonder, like, well, what happened? Was there no one there who was infected? Was there we just lucked out and there was no transmission? Was there something about that event that kept transmission in check? Or, you know, there's just a lot of randomness in like what makes a super spreader event a super spreader event, besides being indoors, which is a really good way to make a super spreader event super spread. But I think as we look to the counties that have, or states that have opened up, and we look to these events like the mass protests or some of the stuff that was happening over Memorial Day weekend with some really crowded events, you know, we may see some big spikes, or some of those events may not turn out to generate a lot of new cases. So there's just going to be a lot of heterogeneity in where and when we start to see some places tick up again.
A+ Allison for nerdy girl word heterogeneity.
Heterogeneity, sorry, that's just like variation, a lot of differences across space.
Yeah.
Which I think is a great point, because it's going to make it hard to kind of assign, you know, blame. Like everybody in the news wants, for different reasons, wants to point to early lockdown endings or, you know, protests and point to that if there is a spike later on. But it's going to be, because of all of this randomness, it's going to be very hard to just even look at data across local areas and say, attribute it to one specific event. So just keep that in mind if you do see that in the news, to have some healthy skepticism about any one policy change kind of leading to direct changes in the epidemic.
Yeah, I have seen claims flying around that the spike, or it's not really a spike, but there's been a little rise in cases in the United States, and that's attributable to the protests. It is too early to make that attribution, you know, but there have been a lot of other changes in the United States in the last couple of weeks here in terms of our shelter in place or our lockdown, our outbreak control strategies. So yes, I agree with all of that. So let's tackle one more practical piece of advice that I think relates to our next topic. Someone has asked on the live feed, can you give some advice to young people who are demonstrating but who live with folks who are at risk? So exit and entry protocol. How do we protect people in these complicated who's in my bubble situations?
I think a lot depends on the structure of your physical dwelling in some ways. You know, if you have a separate bedroom and you can sort of maintain space between you and other members of your household and minimize those shared spaces in your home, like the kitchen and bathroom, or do extra cleaning, you know, wearing masks even inside your home in those situations, those are some of the things that you could be doing to keep the germs that you may have acquired with you.
Well, yeah, I think it raises a good point too about how important communication is around this. So, you know, we had people making decisions about being out and protesting. They may be living in households where either people weren't making that same decision or potentially were at higher risk. And so at least having some shared understanding of how this is going to go and negotiating and navigating to be as safe as possible, I think is really important.
Mm-hmm.
And I think, again, it depends a bit on the level of risk in your household, and just gauging kind of how high the stakes are. And, you know, so maybe if you are really worried, you might want to spend a couple weeks somewhere else if there is a safe place where you can isolate away from vulnerable family members. If they're, you know, very elderly or have some other health risk factors. Yeah, I mean, because it's still that, you know, the stakes are very high for those vulnerable, you know, people in your family. So creative solutions. But yes, I think talking to them about what kind of risk they want to bear having you in the house is a really good idea as well.
Yeah, I know someone who got COVID-19 and managed to not pass it on to anyone in his household with scrupulous hand washing and surface cleaning and wearing a mask essentially full time. So it is possible. And I think it is important to protect, especially if you live with people who are high risk. It is important to assume that you have caught it at these protests and then do what you can to prevent giving it to them in your home. And I think those were great suggestions. So we had a few other questions that are kind of in the same vein around how do you manage these really complex We've talked a lot about who's in your bubble, I call it a germosphere sometime. Who are you sharing germs with? And how far does that network of your germosphere extend? And there are people who are in really complex germospheres, bubbles that have different parts, and maybe the parts aren't in great communication with one another, and blended families. How do we navigate, for example, separated parents who are sharing custody of a child and going back and forth? And I think we can, use this as a chance to talk more generally about how to open our bubbles and how to think about those more complicated germ sharing opportunities.
I mean, one thing that came to mind, knowing that we were maybe going to talk about this, is coming back to that idea of pooled risk and the things that you can personally control, so if you know that you have no choice but to be in partnership in a divorce situation or something else where you don't have all the control over what happens in that household, like, you can minimize the risks in your own household, and together the pooled risk becomes lower. And that maybe your first attempt, what you can do before going to mediation or going to a lawyer, or taking some other action to try to have more control over the situation.
Mm-hmm. I don't know if you guys have any thoughts, but I know some people were raising whether it would be better to kind of change the arrangements to have longer stints with one parent instead of sort of 2 days a week. And my sense is, from an infection control standpoint, that might be better than splitting up multiple days, back and forth within 1 week. And over the summer, that might be more possible, I guess, to have more extended periods with one parent instead of switching back and forth, because that really brings together all these different social networks continuously if you're swapping kids all the time. So that's something to consider possibly over the summer if it works.
Right, and I think you can think carefully about how subsequent sort of either vacations or trips that a kid might take with different parts of the family. Again, where are the grandparents involved in that calendar, and can we put the grandparent exposure at a place in that calendar where it's going to be safest for them, and kind of lead those discussions with, we have some vulnerable people in this germ bubble. Let's prioritize their safety.
Yeah, I think that's a good point, Alison, with the timing of bookending visits, potentially in a time frame that gives you the greatest sense that you've passed sort of that period where you may have symptoms and or you're kind of in the clear. And we usually think about that as like a 2-week window.
So Alison brought this up before, but I also want to emphasize how important, in my experience, open communication is. And I know that's a real challenge in some blended family situations, but I think it's really critical to have open communication about what kinds of activities and what your risk tolerance is as you try to navigate all of these complicated interactions. So let's turn to another subject here. We're getting a ton of questions about school and summer camp, and I do want to address those. So, can you guys see my new crystal ball?
It's pretty.
Alison, yeah, thank you. Alison, I know your crystal ball has been hard at work on forecasting what's going to happen in the fall. So why don't you talk to us a little bit about school?
Sure.
And in particular, I want to know your general thoughts about school and about how we can think about these issues of harm reduction in kids in school.
Yeah. So this is obviously a topic on literally everyone's mind. And it's true whether you're a parent or a staff member or teacher at a preschool versus all the way up to higher ed, but maybe let's focus on sort of K-12 right now. A lot of states, Pennsylvania included, are starting to issue some guidance to states, to school districts within the state. Pennsylvania, for example, has published basically a set of requirements for a health and safety plan that every school district, every public school district is required to file, and private and parochial schools are strongly encouraged to file and get approved by whatever their governing body is. And it covers everything from, you know, ventilation and bathroom cleaning to, you know, how do we organize classrooms? How do we get desks apart from each other? How do we think about grouping kids? And I will say, at least for the schools that I've spoken to, it's pretty overwhelming. And I think one of the overwhelming things is they don't necessarily know where to start and where to prioritize. So for example, of all the things that the state of Pennsylvania is asking schools to consider in their plans, I think there were 81 considerations in this template plan. Which ones are most important and which ones are going to make the biggest difference? And, you know, we don't have you know, strong evidence yet on that. So I think most of the guidance that sort of epidemiologists and public health folks are talking about now is sort of applying other lessons from infectious disease to the school setting. And then the other big piece of this that I want to mention is there's, of course, huge variation in the resources that schools and school districts have to implement this stuff. So if I just think about here in Philadelphia and our school district, a lot of our buildings are very old. You know, they were built in the 1920s and 1930s. They haven't been sort of renovated continuously, and the HVAC systems are old. And when we think about like the ideal ventilation we'd have, where I think you want to turn over the outside air and the inside air like 4 times an hour, those HVAC systems aren't up to that. And then when you hear like, well, just keep the kids outdoors all day, you know, that's challenging too with big urban schools. So
and winter.
In winter, yes.
And I mean, Amanda and I live in a place where
winter starts early in Wisconsin.
It starts in September.
Exactly. Yeah. So it's a great plan for the first 2 weeks of September. And I think the other big question mark for schools is, you know, are we going to have a big second wave of cases in like October, November? I mean, the modeling would certainly suggest that's very, very likely. If nothing else, flu season will start. And how do we set up a plan so that if some trigger is triggered or some benchmark is triggered, everybody goes home again? So how do we plan now for kind of nimble flexing in and out of school? And I think that just like triples, quadruples, exponentiates the complexity of planning. I think there's a lot of pressure to get kids back to school. And then the tension is with a lot of other people worrying about teachers, about vulnerable people in kids' households, and to what extent is being back at school going to be another engine for transmission in the fall. So that was a lot of concerns. That was not a lot of answers or crystal ball stuff, but that's what's on people's mind. The schools I'm talking to, all that stuff is what's on their mind.
What strikes me is just how much this has revealed about the extent to which our schools are under-resourced and how much we rely on them to provide social services in addition to educating our kids. It's really a striking example of how much challenge the schools face under regular circumstances, and now being tasked with this huge additional planning process is really hard.
Yeah, I think we're starting to see this week some evidence, some early, you know, rapid evidence from the education field about how much kids have missed, like how much learning gap have we produced just this spring with going to learn from home, and you know, the kids most at risk for increased gaps if the fall is also not in person.
Yeah. Any additional thoughts on returning to school from Jen or Amanda?
I think many of those same issues exist at the university level. And like Alison said, I'm involved in some of those committees, and, you know, the nimbleness, being able to have a systematic way to identify that we're reaching a tipping point where the opportunity cost of being in person is going to, you know, be too high, and being able to scale back, pull back, and come up, you know, revert back to distance learning or online classes. Some of the other strategies that I've seen thrown around there are either starting a semester early or ending it at Thanksgiving. So especially at the university setting, that could be a solution to avoid people traveling home for Thanksgiving and then traveling back to campus during what will likely be, if we get that far, both flu and COVID circulating. And so I think there's a lot of adaptive solutions that are on the table right now in trying to hedge what's going to be the most reasonable approach. That, we can't eliminate all risk, but if we want to go back to in-person instruction, what are the best bang for your buck strategies, and then that, how can we be flexible? And so that, that was one other thing that I've seen thrown around. And then this idea of cohorting, which maybe Jen wants to talk about, right? This idea that, and Alison, you've also, talked about this, this idea that a major strategy could be to have consistent groups of kids, either whether that's in a K-12 situation or a university situation. I liken that to sort of advanced learning communities at the university level sort of already do this. You really have intense living situation and learning situation with a set group of people. And, that makes tracking cases more easy. It makes, it eliminates some of that cross-pollination where we would have increased spread. So I don't know, maybe Jen, do you want to talk a little bit about that?
Yeah, I'll jump in on that because exactly the paper that Alison was referencing used social network analysis to kind of, it's very similar to the idea of the bubbles, but kind of applying it to the school setting. But the basic idea is this small world effect, that the sort of 7 degrees from Kevin Bacon thing, that we're all actually really connected with just a few steps from all the people we know. And this is, really true at universities and schools. But you can kind of show that just repeating interactions more with the same people, so the bubble, or kind of cohorting groups of students who have more of their student classes and living arrangements together, it really does reduce these connections, the time it takes to kind of, for all these social networks to reach each other. And, really, it can reduce the spread of the infection a lot, or at least, slow it down, which in the context of COVID is still really important. So, no, I think the cohorting idea is really great if we can get people into kind of smaller groups. Even in the K through 12, I was sort of, thinking how this might work of sort of in high school. It's, it might be harder, but if you can sort of have that flexibility that Alison mentioned with, A and B groups that maybe do a little bit of on and off of in-person or, remote learning. I think these might be strategies that we, yes, need to plan ahead and think about kind of before the crisis point hits. So I really like Amanda's idea that we should have some decision rules ahead of time, instead of, once a case or a few cases crop up, everybody panics and shuts down the schools again. I think it's really important that we plan ahead of time sort of what those important decision points are, what sort of these hybrid intermediate steps might be of pulsing on and off home instruction. But I think what we've really shown and what we're learning about the super spreading events is that some of these just smaller, interventions that we're talking about can have a big effect on suppressing the transmission. So we shouldn't underestimate what these small measures could do across, entire communities.
And I think one other public health topic that I'm not sure Dear Pandemic has addressed yet is the idea of surveillance. And how do we monitor for an outbreak cropping up, especially if we have this 2-week lag before we see it in, population level positive cases. I know here at UW-Madison, there's some talk about how do we do surveillance. And in public health, that word surveillance means we are doing some kind of structured program to monitor for disease, right? So it could look like random sample testing, or in some places they're actually testing the public sewage system to see what the viral load is locally as a method of surveillance.
Right?
What's that?
Schools could use that as part of the science
Chemistry class.
Yeah, sure. Virology might become a really popular subject going forward here. Yeah, so I think the other thing I want to emphasize about looking ahead to fall is that my crystal ball has not been working very well. Um,
Get the 8 ball.
September is super far away in pandemic time. So it is impossible to model what is going to be happening pandemic wise in September. And so I think this point of having flexibility and contingency planning is really all we can do at this point. If you want to know what to do in September, it has to be like an if then kind of a plan, because there's just no way to predict what's really going to be happening by then.
And it'll be different state to state and
Yeah,
even county.
absolutely. Yeah, because of that that heterogeneity that we talked about before. So
maybe we can have some new treatments or good news on the.
Yeah, exactly. And also the disease itself and our response to it in a treatment setting is evolving. So lots of things could happen by September. I mean, when I think back 3 months ago, in fact, I think this might be the 3-month anniversary of Dear Pandemic. Now that I think about it, everything was different, right? So 3 months is a long time.
It seems like 3 years.
It seems like 3 years. It really does. So here's a related question that I want to ask. I think I want to ask this one to Jen. Someone asked, I'm a school teacher. Should I get antibody tested before I go back to school?
Okay.
What do you think?
Jen's like, okay, that question.
All the past week.
Yeah, it's a really good question.
And I'll say, so not just for school teachers, but like a lot of people are asking, should I get tested? I had a thing in the fall. I had a thing in March.
Yeah. I think the important question to ask right now is, what would you do with that information? So, would you change your behavior? And if, the answer is that you shouldn't change your behavior right now based on these antibody tests, because they're just not reliable enough.
So can you, before we dive into that, can you just give us the once over of the difference between PCR and antibody testing?
Yeah, absolutely. So the PCR tests that are what we're giving people to test if they have the active infection. And that tests, that's the nasal swabs right now that go really deep into your brain. And what they need to do is get, the genetic.
Not actually deep into your brain.
It just feels that way.
Just really deep in your nose.
Looks like that.
Top tier for your nose.
Yeah, it looks like a nightmare. But what the idea is to get to test for the genetic material of the actual virus. So that means the virus is there and still replicating in you, and that would indicate an active infection and that you're potentially transmissible. If you had the virus several months ago and you've recovered, you're not going to test positive by the PCR test because your body has successfully eliminated the actual virus. But after a week or two of fighting the infection, your body will produce antibodies that we can measure in your blood. We don't have to measure them, luckily, through the nasal swab. And that, we use for lots of different infections, to test whether you've been exposed to certain things. And so it really, as long as your immunity, as long as your antibodies are there, it sort of indicates prior exposure. So it indicates prior exposure, but what it doesn't tell us for sure right now is whether you're immune. So that's an important thing. And we don't know right now just because the virus hasn't been, around long enough. So we haven't seen people re-exposed and, to see whether the antibodies protect them. We truly believe there will be some duration of of protection from antibodies based on other similar infections, but we can't say for sure. And, we don't know if it would just lessen the severity of a new infection or protect you entirely. And we don't know how long the antibodies would last. But the main reason right now why I wouldn't recommend antibody tests is that they're not accurate enough. I mean, first of all, there's a lot of tests out there, commercial tests right now with varying, degrees of reliability. But even the most reliable ones, they might say that they have 99% specificity, which sounds really good. But there's kind of this tricky thing in measuring the epidemiology of infections that when not a lot of people have the infection, and we sort of think, seroprevalence, which is what we call the percent of people we think have been exposed, in the whole country. is not very high. It might be on average 3% or 5%. In really hot spots like New York, it might have been 20%, but that's still 80% of people, who haven't been exposed. So if the overall prevalence is low in the population, a lot of people who test positive in the antibody tests are going to be false positives. And it is a little bit of a complicated epidemiology problem set to show you why that's true. But I think we can do a post that works out some of that math. So the problem will be if you get a positive antibody
or if you
test.
can't do the math, just take our word for it. We can.
Yeah,
We'll show you how to do
it's interesting because it doesn't make sense if it's 99% specific. Why should there be so many false positives? But that's just because, if there's only 10% of the population has had it, then there's 900 people who might, should test negative. But if even 1% of them tests positive as a false positive, it's a lot of people. So the problem is, even if you get a positive test right now, I wouldn't change my behavior based on that because there's a good likelihood that it's a false positive. And that's going to stay true, for a while the prevalence is low, and especially until these tests get a little bit better or they make follow-up tests. So sometimes we have screening tests that have a lot of false positives. I don't know if it's not the same prenatal testing, but I remember when I was pregnant, those blood tests that would screen for genetic abnormalities, and a lot of people would test positive and then have to have a follow-up like amniocentesis, or I think those tests have changed, but that's the same idea. Sometimes screening tests give a lot of false positives, and then you do something that's a little more sensitive, but that would require follow-up tests, and we're not.
Another good example that a lot of our viewers will be familiar with is mammography. There are a lot of false positives on a mammogram. And then, if you get something suspicious on a mammogram, you go in for follow-up. And in most cases, that follow-up, it turns out everything is fine.
So sorry, I'm going on as if it's an epidemiology lecture, but no, bottom line is they're not accurate enough right now to change your behavior or to, decide that you're not going to infect someone because you've already had it. So, it could be a curiosity, but even then, if whatever result you got, I would still be skeptical of it. So I think when we as the nerdy girls think that there's a good test out there, we'll let you guys know and give our updated advice on that. But right now, it's not worth the money.
And it's a lot of money.
Yeah.
Excellent. Okay, so let's turn to, we've got a bunch of questions that are sort of all in the theme of how do I summer? How do I have my summer? I want to have my summer. What do I do? And these questions include, what about pickup basketball and football games? What about my kids' little league starting? My playgrounds are still closed, but the ball courts are open. Do kids need to wear masks outside? Summer stuff. So let's see, who wants to tackle that first?
Well, I'll tackle it first with a little guideline, little rule of thumb that Dear Pandemic and our partner Impact released this week called Stay Smart. And SMART is an acronym. We've published it on the Facebook page. We'll probably publish it again. But it doesn't show up against the purple background. So SMART. So S is space. So we still want to keep distance as much as possible. M is masked. A is air. So outside or well-ventilated area. R is restrict. And that's the tough one. That's keeping your social group to a pretty stable, small bubble of those people you sort of know and share risk preferences with. And T is time, keeping it short. So space, mask, air, restrict, time, stay smart.
I'm going to post it in the comments on this video right now.
Yeah. Okay. So any event or socializing activity that you want to think about this summer, just keep that get smart thing, stay smart in the back of your mind. And all of this is on a spectrum, right? There are not smart activities and non-smart activities. All of those are sort of choices along a spectrum. And making sort of the best choice that you can over and over again is going to make for a safer, happier summer.
Yeah. That's what I was going to say, that Alison should start by introducing the SMART idea. that we can also remember that like stacking those things is also beneficial, right? So in the areas that we're able to do multiple of those things, that also reduces risk to a greater extent than maybe any, one of them alone. Specific activities, are we gonna talk about that?
Great. Well, yeah, I'm not sure. The sports are tough, but
Okay.
I just wanted to mention somebody I knew gave an example of a new play date where people bring the kids brought their own blow up pools that were safely distanced, but like we're in the same yard, and they just had a blast, being in the same vicinity. So I think kids are showing us that even if they're in the same vicinity outside but distance, they can still have a ton of fun. So
Yeah.
I think kids might be better at that flexibility than we imagine they are.
And I think for my kids, because I was very strict for very long, they're just glad to even see people outside at this point. And they know that if they don't stay reined in, I'm going to pull them back inside. But in terms of sports, I think, Malia, maybe something worth addressing is this issue of like surface contamination and like the duration of time and the closeness. So some sports themselves, like basketball and football, to me seem like close contact sports. Even something like soccer is a close contact sport. Something like playing catch from a 20-foot distance, if you are taking breaks to use hand sanitizer, is to me on the safer end of that spectrum of doing sports. Keeping consistent groups of kids together. I want to give a shout out to my local Little League that against all odds and neighboring communities decided to take an approach of doing small group sort of skills-based activity with small groups of less than 10 kids instead of playing games and interleague games. And they took to heart that advice that, that CDC has put out, I think, where on the range of risk of sports activities, those that involve intercity play and the most commingling of teams are going to be on the higher end of that risk spectrum. And those that involve small, all the way down to those involving small groups and sort of taking measures like wearing masks, keeping social distancing, and using hand washing or hand sanitizer to reduce sort of any transmission through fomites are going to be at the lower risk spectrum of that, option. And so thank you, Shore Little League.
Yeah, and that gets back to this idea we've talked about a couple times of the complexity of our germosphere, and that's what the R in SMART is restrict, right? It's much higher risk to have your kid going to Little League practice over and over with the same 10 kids. That's relatively low risk as compared to having let's say a big swim meet where you've got kids across several different pools and all of their parents together in close proximity to one another, right? They're both going to be outdoors. They're both going to be involving a lot of respiratory droplets because people are being physically active, but they are probably different risks just because of how wide that network goes.
Also imagine the difference in having to notify or contact trace those groups in the case someone does test positive, like a parent from that group does test positive. If it's just the 10 kids in your baseball team that is just doing skills this summer versus, by the way, at the swim meet where there were people from 8 different towns.
Shouting in the stands, yeah.
Yeah, so it really simplifies contact tracing in the event of a case.
Yeah.
And I think, this particular, group too has written up guidelines. Everyone had to read them. And I'm probably a little biased because my nurse husband is coaching. So I know, and he knows that if he doesn't follow these guidelines, he'll hear it from me. And he's very diligent. So I have some peace of mind there. But, and there are systems in place for like you said, notifying if someone becomes ill or what steps have to be taken and how we have to take a 2-week break and all quarantine. And these expectations are very explicit and that is going to help a lot in that process.
Yes, that's once again that communication piece where everybody's on the same page. Okay, so let's, we get a lot of questions that are very specific to a particular situation, like, what about touch football, just for example, or what about, my pool asked me several questions about how it might be possible to, like, what are the deck chairs okay, or whatever it is, very specific. So how do you each evaluate a specific, like, what are the rules you're following when you think about a specific situation? I want to help people evaluate these things for themselves. Jen, do you want to start with that one?
Oh, that's a tough one.
You can punt. You can punt if you want.
No,
it's
okay.
fine.
No, I mean, it's happening fast and furious because I have teenagers and things have just opened up here in the last couple of weeks in the UK, and so they're starting to go out. And no, it's a question we face every day because I also have an 86-year-old mother-in-law in my house, and we have to kind of really consider what might be coming in. And then during lockdown, it was black or white, but it's getting much harder. So
exactly.
I guess I'm not super concerned about surface contamination, just thinking about deck chairs. So I don't know. I'm really, in some ways, I'm following the SMART guidelines. We got two of my household got mobile haircuts. We found a mobile barber because they had crazy quarantine hair.
I need it.
Yeah,
Again,
we sat.
Everyone keeping track of the gray grow out? Okay.
He came, he was masked, they were masked, and they sat outside. And I felt like that was, okay because of the air and masking.
That's an amazing solution to haircuts.
Yeah.
That doesn't adhere to many of those SMART guidelines.
Takes mobile pet grooming to a whole new level.
And the kids, and the kids have been seeing some friends, but outside, and they're well aware of what they should be doing. So, but again, I am a bit worried because that's more weather dependent. And once they get accustomed to seeing their friends, it gets harder to say no if it's pouring down rain, like it, often is in London. So, yeah, I think we're all learning along the way, but I think framing those, using those guidelines right now is a good idea. And, weighing the family connections, like it is hard also to tell people to stay apart this long. So I definitely, we are starting to make some, calculated risks, for that human connection. So even the epidemiologists are doing that, I think.
I can give an example from a childcare perspective of something we've done in the last week, if that's helpful.
Sure, yeah.
I have 11 and a half, 9 and a half, and 4.5-year-old boys. The older two are mainly happy to play outside, social distance from neighbors. I tell them 10 feet because I feel like 10 feet is actually, then they end up doing 6 feet. And that's sort of something strategy I use with them. They also just are the children of epidemiologists and have been hearing me on the phone and on meetings, and they get it. But the 4.5-year-old does not understand or cannot have the discipline to do that. And we were planning to have him attend a group childcare camp at the local school that's usually outdoors, but is not necessarily a consistent group of kids. It's not clear if that is going to be available or what the sort of safety precautions are going to be. And so in thinking about those SMART, that acronym, we decided to hire someone to watch our kids outside, essentially to keep social distance from them on the days that the weather is nice enough to just basically be like a hall monitor for our kids outside, to be like, hey,
yard monitor,
you're getting a little too close. They're going to wear a mask. I brought my 4.5-year-old's train tracks, Play-Doh, sand, all this stuff out onto our front porch, and basically locked the door for 4 hours on Friday. This person also had our dog outside, and just that little bit of breathing room where they're still in earshot. I'm still there to deal with any major catastrophes. But feeling like that was space, a mask, air, restricted, that this is just one new person who's getting introduced into our household, and that it's for 2 to 4 hours at a time. Those were the criteria that I used to say, we have to do something. This is how I'm willing, this seems lower risk than some of the other options that were available.
So I really want to ask this question. I want to hear what you think too, Alison, but there's been both of you have said a lot of things about outside. Can you get sick outside?
Yes.
Yeah.
So why is outside better?
My colleague.
And how much, like, why, how much better? Why do we keep saying outside?
Yeah. So I think when all the sort of outside versus inside evidence was starting to accumulate a few years ago, it feels like that, a few weeks ago, I heard three metaphors that I thought were helpful in thinking about this. One was if you're eating with people, if like you're at a restaurant and someone is smoking, if you're inside, the whole restaurant is going to smell like smoke really quickly. You're going to know that there's a smoker in there. If you're outside, there's just more chance that that smoke is going to disperse. It's less chance like enough smoke molecules are going to waft over to you and you're going to notice them. It's the same with virus, right? If you're outside, you know, chances are if there are droplets that are being expelled, you know, they've got a better chance of kind of blowing away from you, and there's just more ventilation. You could also think, I've heard people tell their kids, like, you want to be far enough away that if that person farts, you don't smell it. So the fart rule. And then also my colleague who's an entomologist was talking about, you know, think about hornets. If you're outside and there's like 4 hornets buzzing around, you know, you've got a pretty good chance of kind of, you know, getting away from them or sweeping them away, you know, flicking them away. If you're in a closed room and there's 4 hornets flying around, like that's an emergency. Like everyone's going to be kind of freaked out that there's 4 hornets flying around. So I think all 3 of those are good ways of just understanding that the ventilation and the air and the fact that stuff's going to kind of waft on by is better outside. Is it risk-free? No. Are we learning quickly, like quantitatively, how much does risk drop? We are, but we don't have sort of controlled studies where we see the same thing happen inside versus outside and see what the risk is. These are all kind of accumulating descriptive studies of how much transmission happens in an indoor event and separately in an outdoor event.
Great. Okay, so we are at 1 hour and I just want to wrap up. Maybe we can do a quick round of each of us say the one thing that's on our mind for this next week. What's your one thing right now?
My kid's graduating from high school and hoping to help her and her friend group figure out how to implement Stay Smart for the summer as a social group so they can have a fun summer.
I think I'm right there too. We just had a high school graduation yesterday virtually, so that was fun. And yeah, they want to be together, so it's very hard. But I'll just add, I really want to come back to the US at some point this summer. So I'm thinking about air travel and summer travel in general.
Malia, do you have one?
I mean, my mind has been really a lot on the Black Lives Matter protests and this tension that I'm feeling between supporting the protesters and the root causes of the protest, and how I feel that I'm being put in a position in the media, at least, of having to arbitrate which is more important, the pandemic or the Black Lives Matter movement. And you know, as I've said a couple times, I don't want to get into the despair Olympics here. They're both very important, and I can't decide which. You know, it's not even meaningful to decide which is more important because as Amanda has said several times more eloquently than I will, addressing those systemic, those structural racism issues will actually help both the goals, you know, violence and the Black Lives Matter movement, and also the pandemic, which is affecting Black and brown people more than white people like the 4 of us. So so that's what's been on my mind. I've had a very philosophical sort of week, I guess.
I would echo that. I'm in that same mind frame where I realize the essentialness of these protests, and hope, you know, that there's other steps that people take, people like me who are white and privileged, relatively, beyond protesting, beyond being out there, to think about the structures that we benefit from and how that what we can do about that personally.
Yeah. And also looking at my crystal ball, forecasting what's likely to happen over these next couple of weeks as we enter summer and people are opening up. And I think we will see that bump in cases as a result of the protests. So just thinking ahead to how to think about and deal with all of those responses. So, okay, well, I want to thank all three of my nerdy girls for being here with us. This video will be available to rewatch on our Facebook page as much as you want to. And I'm also working on a YouTube channel where I section up the different answers, although, you know, it's a bit spotty. I'm not a media mogul of any sort. So you can look for
teenagers, high schooler,
graduates. Any high school social media interns who want to.
Yeah, absolutely. Send us a PM if you want to volunteer your time to help me with YouTube, because it's definitely not my area of expertise. Okay, so thanks to all three of you, and I hope to see you again soon.
Stay smart, everybody.
Yeah, stay smart.